Thank you, everybody. We're going to get started again a little bit early since we're all here. We have about 40 or 50 people joining us via webcast, so we're anxious to include them in the discussion as well. So I'd like to invite the panelists to come forward, and then Rafael Perez-Escamilla, who is our one of our committee members, is going to serve as moderator, and Sarah Brown, who is also a committee member, is going to serve as the facilitated conversation leader. She's going to be Oprah, yeah. So, panelists, would you like to come forward?
Good afternoon, everyone. I am very pleased to see so many of you still around. I know it has been a long day, and I welcome all of those of you who are following the session over the internet as well. The purpose of this session is to try to distill a little bit the wonderful and rich set of ideas and thoughts that have been expressed throughout the day, both in terms of what we need to do to disseminate and implement the guidelines. And I must say that I totally agree with what I think I'm hearing, that it really doesn't make sense to issue guidelines if the conditions are not in place for the target audience to be able to actually implement those guidelines. So in this instance, what sense does it make to have wonderful pregnancy weight gain guidelines if the system, the environments out there do not allow the moms to implement their wishes to try to gain optimally during pregnancy? I have also heard a pretty much universal consensus among the group that what we are doing now is too little and perhaps too late, because we're not getting to women early on when the strategies that we can put in place are likely to work better to prevent excessive weight gain, and that indeed a radical change is needed in the care of women of childbearing age to be able to successfully implement the IOM gestational weight gain guidelines. We have heard wonderful ideas related to the very central role that the healthcare system needs to play. We have listened to the importance of patient-centered care, home care. The amount of coordination that this requires is a very complex task that is still not in place, and that probably will need to be in place for the guidelines to be successfully implemented. We have heard a number of ideas related to ways to change the environments in the communities where the women live so that they can actually have access to healthier foods, more opportunities for physical activity, and for timely prenatal care. And obviously we have listened to the very, very big challenge as to how to get to women preconceptionally, which I know is very easy to identify it as an area where we need to improve, but it's not that easy to identify who, where, and when this is going to be happening. So having said this, I would like to introduce our facilitator of the discussion that we're going to have to try to distill the wonderful ideas and integrate some of them hopefully into some priorities for future action. And our facilitator is Sarah Brown, who is a co-founder and CEO of the National Campaign to Prevent Teen and Unplanned Pregnancy. Mrs. Brown has served on the advisory boards of many national organizations, including the Population Advisory Board of the David and Lucille Packard Foundation, the American College of Obstetricians and Gynecologists, the DC Majors Committee on Reducing Teenage Pregnancies and Out-of-Wedlock Births, and Teen People magazine. She's a member of the planning committee for dissemination of the pregnancy weight gain guidelines, and I welcome Sarah to the podium. Or you have your own microphone, so you can stay where you are.